Thank you. So Annie's given an overview of the national panel, and our thematic analysis relating to COVID cases is an example of the work that we do. So just to say a brief word about what I'm going to cover, and I only have a 10-minute presentation today. So hopefully many of you have had the opportunity to have a look at the podcast, which we uploaded last week. Which involves me interviewing the author, the main author of the review. And in particular, in the podcast, the author explains the detail of the methodology of the review. So for today, I'm just going to briefly touch on that methodology and also explain a little bit about some of the wider research. But we'll spend most of our time looking at the key findings and the learning, because we think that will be most helpful to you in terms of what you can take back into practice. The review covered the period March to September, including the first lockdown, and over that time we received around 300 serious incident notifications and reviewed all the rapid reviews associated with those. And I'll refer to SINs as a little abbreviation there. So from March last year, we asked safeguarding partners, as they were submitting those rapid reviews, undertaking the rapid reviews, to flag if they felt that there was that COVID had been a factor in that particular incident. And safeguarding partners flagged that 44 of those cases, they did feel that COVID had been a factor. So we then reviewed those cases in detail to look for evidence to support that judgment. We weren't doubting the judgment of the safeguarding partners, but if we wanted to sort of pull out some themes, we really wanted to ensure that we had we felt we could rely upon that kind of judgment. We also compared this with a control group representing a cross-section of the types of SINs that we would typically see. So I mentioned that we recognise that in addition to our thematic analysis, various organisations have commissioned research evaluation into the impact of lockdown on vulnerable children and families. And much of that work, and there's some really fabulous work that's now been published, particularly focuses perhaps on how practice has had to adapt when, for example, face-to-face contacts have not been possible. But our thematic analysis is a little bit different, as through the SINs and the rapid reviews, as Annie was indicating earlier, we have a very unique lens from the national panel into the safeguarding system across England. So alongside that other research, we've really therefore got quite a rich seam of intelligence that we can use not only in periods of lockdown, but we can take into our practice more generally. And I'm sure we'll perhaps pick up on that a little bit later. So this slide just highlights part of that body of research. And I'd very much encourage you to have a little look across some of those websites linked to those organisations mentioned there, because there's some really useful work that's now been published. So coming on then to just a few words about the cases, the 44 cases that we audited. What was the kind of profile of those cases? So what we were looking for was, what was the relative impact of COVID? How significant was that impact in terms of that incident? And as you can see from this bar chart, the four largest groups that we saw across those 44 cases: non-accidental injury, sudden unexpected death in infants or SUDI, suicide and severe neglect. And these are generally the categories where we tend to see the greatest proportion of cases. And as you can see, the standout there is non-accidental injury, and in particular in under ones. Now, we always apply a little caution with the numbers, because even 44 is not a massive number. So we always do apply a little caution, but we're very confident that actually these were the particular categories where COVID appears to have had quite a feature. So I'm going to come on now to the next stage of analysis. So from that analysis, we determined COVID-19 created what we've referred to as a situational risk for children and families. So what we mean by that is it presents a unique set of circumstances that increases the likelihood of an incident in vulnerable children and their families, potentially already living in a context of greater risk. And from our analysis, we've categorised four main factors that often, of course, operate in combination. So those factors are parental and family stressors, exacerbated vulnerabilities for children and young people, the impact of school closures, and the impact on the adaptations to practice. And as Annie acknowledged earlier on, actually there's been some fantastic innovation there. So I'm just going to say, just to give you a few headlines from what we saw across those four key factors. So just starting with parental and family stresses, and you may be thinking, well, that's a bit of an obvious risk. Stressed parents, homeschooling, perhaps drinking more than they should in order to kind of cope with those additional pressures. And we know, of course, that the nature and quality of relationships between parents has a direct impact on the well-being of children. And of course, the circumstances that the pandemic has presented has often been, and we often saw that in these 44 cases, it proved to be the tipping point with increased domestic violence, overcrowding, perhaps no access to outside space, additional financial pressures through furlough, and isolations from some of those wider family and friend support structures. So we need to think about the usual presenting risks in families, but how is the situation going to unfold, and how are those vulnerabilities, how are they going to increase? Bearing in mind, of course, that it will be nearly a year that we've all been in this situation, and those families with those stresses, those will have continued to unfold and change over that time. So it's not a kind of static process. We need to keep reviewing that. So the next category that I mentioned related to exacerbated vulnerabilities for children and families. So in this group, within the 44, these tended to be families where this was a factor where perhaps they were already receiving additional support before the pandemic came along. So this may be perhaps a young person in the family with mental health difficulties, perhaps because of early trauma, where of course the disruption to their support system may make them even more vulnerable to many different harms, online harms, exploitation, etc. It may be a household where perhaps those parents struggle to protect their children and usually receive additional support with their parenting. So I think from this category, what seems to come out as really important is the need to ensure that those existing plans, so whether they're child in need plans, child protection plans, treatment plans, safety plans, we need to really bolster those plans at this time, making sure that those children and young people with less access to perhaps a trusted adult outside of their home, that we're really ensuring that those plans are as strong as they possibly can be. So the impact of school closures. And of course, we had, even during lockdown 1, we had different phases to school closures. And the thematic analysis largely covered the period when only key worker children and children identified as vulnerable were in school. But actually what we found, and I think you will be aware of this more generally, the reality was that a large proportion of those vulnerable children actually weren't in school. And we found through the cases that we looked at that children of parents who themselves had long-term conditions, children with a disability seemed to be particularly vulnerable. Often in those cases, we would see that parents were really quite fearful of their child catching COVID. And we do think it's going to be really important as schools reopen that actually we can build that confidence with the public, with parents, around schools being a COVID safe environment, because that was definitely quite a factor that came through. And of course, this lost opportunity through school closures to provide an environment for children to perhaps disclose what's going on at home, and for that early identification of abuse and the intervention that might need to follow. And then finally, the last category related to the adaptations to achieve COVID safe practice. And as we've already said this afternoon, some really, really innovative examples of practice being adapted, particularly for the most vulnerable children. And many parts of the country, many safeguarding partnerships, local authorities used various different risk tools in order to identify those particularly vulnerable children, to kind of target support and make sure that they wouldn't become hidden from harm. And that's great. I think really important that those continue to be refreshed, because actually what we found in some of the cases that we were looking at was that quite a number of those children were not children who were flagged through those particular systems. They were just kind of on the fringes of those risks. And of course, this is not all about reduced face-to-face contact. We really need to make sure that some of the usual systems that we rely upon for spotting signs of abuse or neglect, so for example, in A&E departments, in primary care, which at the moment, of course, are under particular pressure, we need to make sure that that COVID-safe practice doesn't in any way become kind of task focused. So for example, perhaps a parent taking a child for immunisation, ordinarily, that's that real opportunity, isn't it, to hear about what else is happening, what else is going on that potentially could be having perhaps quite an adverse impact on that child. With COVID safe practice, I think there is that risk that it becomes just focused on the task itself, the immunisation. So really important that we remember that. We did find that some services had been paused, or some staff had been diverted to COVID-specific roles. There's been quite a lot of coverage, hasn't there, about health visiting staff, and obviously there was a clear directive that came out about that actually that shouldn't be happening. But that was the case, and we certainly saw that in the cases that we looked at. So although all our analysis focused on the serious incidents that occurred for children and young people, I think as we've reflected on this piece of work, we've also been very mindful of the impact on the workforce. And again, we might perhaps talk a little bit more about that when we go into the breakouts in a moment. So on their professional practice, and thinking about the team leaders, the managers, providing the right kind of supervision and support in a context where that practice has had to change very significantly and very quickly. So just to break out, so our thematic analysis, we feel, has provided a unique window into the safeguarding system. It's enabled us to consider the impact of COVID, and as we've described, looking at it as a situational risk, this extra set of really quite complex factors. It's reinforced which groups are most vulnerable and the need to keep refreshing our approach to identifying and addressing abuse and neglect. I think also the importance of drawing on some of the frameworks, the evidence-informed frameworks that actually are already out there. As a couple of examples from the national panel, we published the Sudi review a few months ago, and that talked about the risk associated with disruption to usual routines, and gave some really great practical tools in terms of what we can all do to try and minimise that risk. Well, COVID is most definitely a huge disruption, isn't it, to a family routine. So we do have some of those reviews, and even at a busy time, important to remember how we can use those. We've got the non-accidental injury review of under ones that will be published later this year, and again, that hopefully will be very helpful. We need to continue to analyse cases, and our findings are shared not only with practice but safeguarding partnerships, and also with ministers too. Annie and I met very recently with Vicky Ford, who is very, very interested in this piece of work, as the government continue to think about and roll out policy to try and ensure that the most vulnerable children and families are protected. And I'm sure today, I know the government are thinking a lot about recovery and what will we need to do to restore some of the and address some of the issues that we've seen. So again, we can potentially talk a little bit about that, and we'll have further opportunities in our national role to talk to ministers and influence some of those discussions. So I'm going to pause now. I'm going to hand back to Steve. I want to hear your reflections and generate some debate on some of the themes that we've shared with you. So back to you, Steve.